Hi, I'm Dr. Linda Nedler. I'm the medical director of the 2 Navajo Area uranium programs that assist the uranium workers and the uranium-exposed civilians. Today we're going to talk about the uranium-related issues that you'll encounter in your Navajo patients. When I first came to the Navajo Nation in the early 1980s, the uranium-related health issues were never discussed, even though other health issues such as diabetes were discussed frequently. In our first slide here, this is a photo of an old uranium site just off of the Navajo Nation. It demonstrates the environmental impact on the water table as well as the human risk. It also demonstrates the sheer size of the remediation projects. The remediated tailings pile is that huge hill running the length of the photo in the background. I just wanted to mention that I have no personal financial interest to disclose, and that financial support for this 3-DVD educational project was provided by 2 separate year RECEP grants from the Health Resources and Services Administration titled Radiation Exposure Screening and Education Program. You will see uranium-exposed patients every day, and high suspicion is warranted. You're going to see former uranium workers. They worked in the mines with minimal, if any, safety measures, and many of them are often undocumented. You're also going to see the uranium workers' families who lived at the mines. They drank the water, they did the laundry, and bathed in water refuse from the mines. They washed the workers' contaminated clothing and boots in this water, and the miners came home covered in dust and contaminated the home. You're also going to see current uranium workers. They're working at the cleanup sites. There's also a mill that's still operating in White Mesa, Utah, and you might see some of those workers. You're going to see downwinders. These are people who were exposed from the above-ground atomic bomb testing at the Nevada test site in the 1950s and 60s, or the Trinity, New Mexico site in 1946. Most of the Navajo Nation is considered an exposed area. Elderly who were adults at the time of the tests may now have cancer. Middle-aged adults who were children at the time of the testing are now being diagnosed with cancer, or they need ongoing cancer screenings. You're also going to see those who were community exposed. They were either exposed in the past or they're still currently being exposed. How do they get exposed? They get exposed by contaminated water. Shiprock's water is an active remediation site under EPA. Red Mesa's water tests positive for uranium. This uranium in Red Mesa's water is considered to be naturally occurring and not related to the mining, but nonetheless still as dangerous. You're going to see those that are exposed to contaminated soil. This can either be from the tailing sites or blowing dust that is ubiquitous across the nation. You're also going to see those that are exposed through contaminated structures. These were buildings that were built from mine remnants, and they still have radon gas being expelled from those remnants and contained within the structure. Many are still living on homesteads near abandoned mines and mills, which continues to expose them. This is just a little bit of history of uranium mining on the Navajo Nation. From the 1940s to the 1980s, uranium mining and milling on the Navajo Nation was ongoing. The last mine was closed in 1982 in Sonosti, New Mexico. In total, there were 500 plus uranium mines and 4 uranium mills on the Navajo Nation. Most have been cleaned up to what's considered physical safety standards. It is estimated that thousands of Navajo people worked in these mines and mills and others in surrounding states. The occupational uranium exposure to the workers were because of lack of worker protections. Historically, the Federal Mine Safety and Health Act was not passed until 1977. Some supervisors reportedly believed that the job was safe. I had a worker report to me that his supervisor told him that uranium was safe even if eaten, and then he swallowed some uranium as a demonstration. Radiation itself causes an increased risk of lung cancer in miners and renal cancer in millers and transporters. The mining dust causes a respiratory danger. The high dust work environment in the mines existed and the workers had no respiratory protection, and this caused several lung diseases. Most of the occupational exposure was before 1971. Before 1971, the U.S. government was the sole consumer of uranium for munitions built up during the Cold War. During that time, liability was assumed for uranium-related disease only by the U.S. government. After 1971, the federal government was no longer the sole consumer, and the U.S. government liability was not recognized for this work. The government, however, does recognize exposure and remediation and cleanup workers after 1971. The mining industry recognizes liability after 1971 for their work in providing uranium to various industries. Having been a uranium worker puts a patient at risk for numerous Radiation Exposure Compensation Act recognized health problems. These include respiratory illnesses. The illnesses that are recognized are lung cancer, silicosis, pneumoconiosis, and pulmonary fibrosis. Cor pulmonale, only caused by pulmonary fibrosis, and kidney disease only in millers and ore transporters. Medical monitoring must have a high suspicion for serious lung disease, including cancer. Compensation screening is a little bit different and has some specific testing, and you should refer the patient to RECEP for this annual screening. Frequently, in the medical setting, when a patient has chronic respiratory symptoms such as shortness of breath or dyspnea on exertion, coughing, wheezing, they are symptomatically treated with an inhaler and given a generic diagnosis of chronic lung disease or chronic cough or wheezing, asthma, or reactive airway. In the occupationally exposed, however, an accurate diagnosis is preferred due to potential compensation. In this situation, you should consider spirometry to determine if there's any restrictive or obstructive component and refer to RECEP for additional screening for fibrosis, silicosis, and pneumoconiosis. Many uranium workers have untreated symptoms that may be helped by inhalers and should be considered when you get a history of being a uranium worker. In addition, continue to have high suspicion for serious lung disease, including cancer. This slide shows the geographic location of both uranium worker states as well as the downwind states. The greenish blue area shows what's considered the downwind area. The yellow states include all the states that had uranium occupational sites. What are the health concerns for downwinders? There's been documentation that people who were on site at the above-ground atomic bomb tests or in the fallout area have increased risk of cancer. There is a compensation program for downwinders that have been diagnosed with the following cancers: lung cancer, leukemia, but not chronic lymphocytic leukemia, lymphoma, but not Hodgkin's, multiple myeloma, primary cancers, not metastases, of thyroid, ovary, stomach, brain, male and female breast, liver, bile ducts, salivary gland, small intestines, gallbladder, esophagus, pharynx, pancreas, colon, urinary bladder, but not prostate, not hepatitis, liver disease, and not cirrhosis. Also, people who are eligible for downwind compensation must prove that they lived in one of the designated downwind areas of Nevada, Utah, or Arizona between the periods of above-ground testing. This was January 21st, 1951 to October 31st, 1958, and during the month of June 30th to July 31st, 1962. I want to give you a little bit of history of the community uranium exposure that people have. In 1979, in Church Rock, New Mexico, a retaining pond dam broke, spilling more than 1,000 tons of solid radioactive waste and millions of gallons of contaminated water into the Puerco River. The flow was tracked for about 80 miles and went up through Gallup, New Mexico. It is still unknown the long-term consequences of this disaster. There's also contaminated mines and mills that went unremediated for years before the EPA got involved, and this allowed uranium-contaminated dust to be dispersed over wide areas. Again, the long-term consequences of this is still unknown. Additionally, uranium is a part of the ash from coal-fired power plants, along with other heavy metals such as mercury. These ash piles are not protected from wind or rain. This slide shows a map of the mine sites and the relative radiation levels compared to what's considered background. This was done from a survey by the EPA in October 2008 to November 2011. These results are being used by the EPA to help prioritize cleanup efforts. So, as you can imagine, the red dots are the highest radiation levels and are considered 10 times the background level. What can cause community uranium exposure? This exposure not only occurred in the past, but it is ongoing and it will continue to affect the future generations. Exposure of living within 5 miles of a mine or mill site is a risk factor. 5 miles is an arbitrary designation. No one has determined what significance proximity actually is. There are those living in contaminated structures. As we mentioned before, these are buildings used from mines and mills in the past, and that people were still living in some of these structures. There's also contaminated dirt and gravel that exist in the washes down from the mine sites, and reportedly people will use some of this dirt and gravel in cement construction. Also, many people are unaware of the mine locations. The younger generations do not know the history of the mining and are unaware of the locations to stay away from. They allow their livestock to graze near abandoned mines. They grow food near the abandoned mines, and people recreate near the abandoned mines, such as riding ATVs over areas that were once waste piles. This slide just shows how difficult it is to recognize dangerous sites. On the left, you'll see an old tailings site. On the right, you'll see where the EPA has closed off an old mine entrance. This slide shows the huge remediated tailings pile in Shiprock, New Mexico. When you see this driving down the road, you will see that it occupies quite a large area in Shiprock, New Mexico. And I recently had a client who worked on the remediation project who says that some of the tailings that they removed and placed in this pile came from a location near where the Shiprock Hospital is currently located. There are also uranium-contaminated water sources. These water sources contaminated people in the past as well as currently. In 2015, while I was participating in a uranium health screening, a family was found obtaining water from a contaminated water source in Red Mesa, Arizona. They reported that they had no other source of drinking water and intended to continue using this water source. There's also naturally occurring surface uranium, and this can end up in building materials like cement, as we mentioned earlier. This source of uranium is a source of radon in the buildings, and radon is the number 2 cause of lung cancer, second only to cigarettes. In December 2013, Navajo lawmakers granted a uranium mining company permission to operate a demonstration uranium project using in situ leaching mining. This was done despite a 2005 tribal law banning uranium activities. This approval was later withdrawn in 2015 due to public outcry. Of note, this method of mining, known as in situ leaching, has great potential to contaminate the aquifers. This slide shows homes that were next to an abandoned mine in the Church Rock area. In 2009, the EPA did a soil remediation in this same area. And you can see by this picture the vast amount of soil that was contaminated and had to be removed from this site. This is a uranium-contaminated structure that was used with items from an old mine. This is a picture of an EPA structure being torn down during a remediation project. The community level or non-occupational exposure of uranium is low level, chronic, and often long-term exposure is very difficult to quantify and therefore difficult to study. There's little in the literature to conclusively answer the many questions that patients and providers have about this type of exposure, but the stories and experiences reported by patients are compelling. You should ask the patients about possible exposure routes and document that in their chart. This documentation is crucial. Also, it leads you, the medical providers, and those that follow you to have a high suspicion for the conditions that can be linked to the exposure. Some of the diseases that you will need to consider are kidney problems, autoimmune diseases, hypertension, cancer, and reproductive system problems, as well as infertility. Let's look at the research. The cancer risk is intuitively seems to be raised, but the literature actually is ambiguous. You'll see some research that says that there is an increased risk for cancer, but then there are other articles that say there is no increase in cancer. A study that was done at the University of Texas in Galveston said that they found DNA repair abnormalities, which they felt meant a higher risk for cancer. But then a follow-up study by Boyce from Karnes County found that there was no unusual patterns of cancer mortality in a Texas county with prior uranium mining and milling activities. Arsenic is a common contaminant in uranium waste material, and it's also found in about 15% of unregulated water sources on the Navajo Nation. There is current ongoing research by Dr. Lewis and her colleagues which show that uranium and arsenic can both cause retention of DNA damage as well as causing a synergy with that damage. The metals themselves don't seem to produce damage, but they do seem to inhibit the repair of the DNA damage. In first preliminary data analysis from younger parents, they find that the number of cells with DNA damage increases with the amount of exposure. They found that urinary arsenic interaction is a significant predictor of damage. There seemed to be a three-way interaction showing that zinc tended to reduce the synergistic increase in the damage, and this indicates that perhaps zinc supplementation prior to pregnancy will be important in reducing DNA damage in the fetus. Their ongoing study also showed that there was hypertension and hematologic changes. In 2011, the Dene project used a Bayesian framework for estimating disease risk due to exposure to uranium mine and mill waste on the Navajo Nation. It is being published in the Journal of Royal Statistical Society series. Participants with elevated uranium exposure had decreased white blood cell and lymphocytic blood cell counts. It was also found that female participants had higher uranium exposures and elevated systolic blood pressure compared to women with lower exposures. However, they did not find any exposure-related changes in the diastolic pressure. This is a map showing the relationship of hypertension to abandoned uranium mines. And you'll see that the highest risk of hypertension is in the red areas. And if you compare this map to the map we saw previously for the abandoned mines on the EPA map, it correlates significantly to those abandoned uranium mine sites. This is a look at the southeast portion of the Navajo Nation near Gallup and Church Rock. The 2011 Dene project study was done on 20 Navajo Eastern Agency chapters, and the proximity to abandoned mines and the legacy exposures such as water consumption, eating animals that have grazed near the mines, living with a miner, living at the mining camp. Those environmental legacy exposures increased their blood pressure. So on the left you'll see the map where the participants had one exposure, and on the right had two exposures, which represented a doubling of their risk. This is just the EPA map again, showing the area that we saw on the previous map. There's also an increased risk of bladder and kidney disease. The 2011 Dene project showed a link to kidney disease from living near uranium mines. Again, this article is being published in the Journal of the Royal Statistical Society series. Another article in the Journal of Occupational Medicine Environmental Health showed that the participants near the Fernald, Ohio mill showed an increased prevalence of urinary system disease in those who used a well or cistern for drinking water near the Fernald mill. Also in the Archives of Environmental Occupational Health, they found uranium in drinking water in that study, and they showed a correlation between the uranium excreted in the urine as well as an association with interference in the kidney's reabsorptive function. There's also an increased autoimmune disease connection. Uranium exposure was linked to a high lupus rates in communities living near a former refinery. In November 2012, it was reported at the American College of Rheumatology annual meeting in Washington, D.C., that there was high rates of systemic lupus erythematosus linked to those living in proximity to the Fernald, Ohio processing plant. The Navajo Birth Cohort Study, which is an ongoing study by Dr. Lewis, shows a relationship between exposure to uranium and arsenic and the production of autoantibodies associated with autoimmune diseases. When compared with the usual association of these autoimmune diseases and aging, it seemed to be more prevalent in young men and women in the birth cohort study as compared to a more prevalent in women in the usual age-related disease process. In the NHANES data, there seemed to be a 13.9% prevalence in the U.S. as a whole. In the birth cohort study, there was a 16% ANA positive data obtained. The next slide shows a map again of the eastern portion of the Navajo Nation that we saw previously for hypertension. Again, the map on the left shows those with one legacy exposure and that on the right with two legacy exposures, and you'll see a large area of red which represents a doubling of the odds risk of autoimmune disease. Again, this is the area of the EPA map that is demonstrated in the previous map. Animal studies show a link to reproductive system problems. There seemed to be decreased fertility. There was embryo and fetal toxicity, as well as teratogenicity, as well as reduced growth of the offspring observed. When looking at the content of uranium in drinking water that was even considered below the U.S. EPA standard, there appeared to be estrogen receptor-dependent responses that interfered with female offspring, suggesting decreased fertility. The data supported the conclusion that uranium is an endocrine disrupting chemical, and populations exposed to environmental uranium should be followed for the increased risk of fertility problems and reproductive cancers. The Navajo birth study is an ongoing study, but the initial data analysis shows there appears to be statistically significant association between uranium operations and unfavorable birth outcomes. There was a review in 1992 in the journal Health Physiology where 13,329 births at Shiprock were looked at, and they found more than 320 defective congenital conditions. The only statistical significant association between uranium operations and unfavorable birth outcomes was identified with a mother that was living near tailings or mine dumps. The preliminary Navajo birth cohort study shows that there appears to be interference by uranium with important hormonal processes in the fetus. It was also found that there was commonly iodine deficiency in many of the participants, which would confound the hormonal process interference. There was also found heavy metal byproducts of uranium mining in the participants, specifically arsenic. It is being analyzed in this data of whether or not there appears to be a common inflammatory pathway triggered by the arsenic and or the uranium, which might explain the DNA study findings of increased hypertension and autoimmune disease in those with the community uranium exposure. What are the benefits of what we do for our patients? There was a study which was published in the Journal of Occupational Environmental Medicine in 2009 where they looked at the benefits of health monitoring in those that were exposed to uranium. This study was based on a program that was developed for the workers of the mill in the Fernald, Ohio area. They found decreases in common risk factors such as cholesterol and blood pressure, and even deaths from cancer when people received regular health care. Their conclusion was that comprehensive medical monitoring was indeed a remedy for people affected by defined sources of environmental contaminants. And it was the result of this finding that our Navajo Area Community Uranium Exposure Program was based. The bottom line, what do you tell your patients when you find that they've been exposed to uranium? Because we know there's a link to possible kidney damage, what you need to do is to prevent any further damage to the kidneys. So you want to prevent diabetes, you want to prevent hypertension, you want them to eat a healthy diet, get moderate daily exercise, and intermittently vigorous exercise. You want them to maintain a healthy weight. You want them to get their blood sugar and their blood pressure checked at least yearly. If they have diabetes and hypertension, you want to keep them under control with their diet and exercise and medication. Because of the possible connection to cancer, you want to make sure they get all of the recommended cancer screenings, including Pap tests, mammograms, colonoscopy, and when indicated, PSAs. The benefits of regular health care has been demonstrated to decrease health risks. Make sure your patients know that they should drink water only from regulated sources, and they should get their home schools and offices tested for radon, and make sure that if there's radon found that they get the proper remediation of the structure performed. If radon is suspected, ventilation is essential until testing and corrective action can be completed. This is the contact information for the RECEP office where you can send all of your patients who may have been occupationally exposed. If you have any occupationally exposed patients that has any chronic respiratory symptoms, please refer them to the RECEP office so they can get screened for possible compensation eligibility. If you find fibrosis, silicosis, or reticulonodularities on a person's x-rays and they've not been previously compensated, please refer them to the RECEP office. If you have any patient with cancer or they report that they have a relative that has had cancer, please refer them to the RECEP office so they can get screened for downwind atmospheric exposure and whether or not they may be eligible for any compensation. Remember, this is a free service. Let's talk a minute about documentation. If we have seen the patient in one of our community health screenings, you're going to see a note in the electronic health record under a file called CUE-Community Uranium Exposure. You can click on that note and find the documentation of their exposures. What we'll find really important is that we would like all of the IHS facilities to do consistent documentation. The Navajo Nation funds the Community Uranium Exposure Program, and they do this because they want epidemiological data and they want the ability to be able to search the medical record for this data and also to have it available for potential compensation for patients should the laws change. Historically, we have used the ICD-9 code V82.5 for screening for community exposure when we have found community exposure to exist. V87.02 has been used to document suspected uranium exposure. The ICD-9 code V15.3 was felt to be appropriate for the occupational exposure, and it is found in the record as history of radiation exposure. So V15.3 to be for occupational exposure, and V82.5 and V87.02 to be for community exposure. These are the codes that we have used in the past under ICD-9 to document the community exposure and the former uranium minor or Miller occupational exposure. This has changed with the introduction of SNOMED. This is what it will look like under SNOMED. Under SNOMED, you have the exposure to ionizing radiation from geologic sources. And we use this for the community uranium exposure past and or current. If you have a patient that came in for screening but we were unable to find any actual uranium exposure, then we use the code assessment of history of previous radiation exposure. So in summary, if you find a community exposure, then use the code exposure to ionizing radiation from geologic sources. If you do not find a source of exposure, then use the assessment of history of previous radiation exposure. Underneath that, you see a table where I have converted the codes to the ICD-10 codes. At the time of this recording, the ICD-10 has yet to be implemented, but will be implemented soon. So the V82.5 will convert to ICD-10 Z13.88. The ICD-9 code V87.02 will convert to ICD-10 Z77.012. All of the exposures in the community will go under V87.02. The occupation will remain V15.3, which converts to ICD-10 Z92.3. When you see a patient that has already been compensated for their uranium mining diagnosis and they have DOL benefits, then you should be billing their visit to DOL as a third-party payer. So if you're refilling their inhalers, you should be billing DOL. But you must bill for the appropriate diagnosis. You have to bill for the one that is recognized by DOL. You will find that diagnosis on their DOL card as demonstrated on this slide. Until DOL begins providing new cards and recognizing the new ICD-10 codes, it will be important to keep the connection to the new SNOMED codes to the ICD-9. The SNOMED code for silicosis appears relatively clear. It says chronic silicosis, but over in the comment section on your integrated problem list, you should put the DOL diagnosis ICD-9 502. That way, when we do convert to ICD-10, the coders will know exactly what code to be using, the one that will be accepted by DOL. When you're documenting the community exposure in the record, these are the items that you will want to ask the question. Did they live within 5 miles of an abandoned mine? Did they eat plants that were growing near a mine, mill, or tailing pile? Did they live in a building that they know was contaminated or may have been constructed from materials from the old mine? Did they drink water from a well-known or suspected mill? Did they eat meat from livestock that drank water from contaminated water sources or grazed near the abandoned mine? Did they live with a miner? Did they live at the mining camp? Did they play on the tailing piles? Did they wade or come in contact in any other way with the mine refuse water? Did they herd their livestock near the or inside the abandoned mine? If you would like an EHR template for this documentation, please contact us at the RECEP or Q offices and we will gladly email them to you. The contact information is noted below. Thank you.